Welcome to MCT2D. This video outlines the clinical champion role within the Michigan Collaborative for Type 2 Diabetes, including your responsibilities. We are excited to have you serve as the clinical champion and aim to ensure that you feel prepared for this role. The clinical champion is the MCT2D lead at the practice level. Your role is to engage the healthcare team to get excited about making diabetes care better for your patients. This includes working with the PO to disseminate and share information to other clinicians in your practice, supporting the practice and quality improvement work, completing the MCT2D trainings, and representing your practice at biannual regional meetings. To serve as a clinical champion for MCT2D, you must have a clinical role within the practice. Eligible clinician types are listed here. Additionally, the clinical champion must spend clinical time in each practice that they serve as the clinical champion for. For example, a care manager who works in 2 practices and sees patients in both of those practices is able to serve as the clinical champion for both practices. Covering the clinical champion role, we wanted to share general participation expectations for MCT2D. All MCT2D participants must implement initiatives including guideline-directed medication prescribing, promoting continuous glucose monitoring devices, and promoting low-carbohydrate eating patterns. Physicians participating in MCT2D earn value-based reimbursement on their Blue Cross Blue Shield PPO patients, which is initially participation-based with performance measures added in subsequent years. We'll go over the Year 1 measures later in this presentation. Now, let's go over some of the responsibilities specific to the clinical champions. Clinical champions must complete the 4 trainings on the MCT2D initiatives by December 13, 2024, 1 on each initiative and 1 discussing how the 3 initiatives work together. Each training is offered live once and then is recorded and available for on-demand viewing. Dates for the live trainings are shown on this slide and will be shared with you via email. CME is provided for both live and on-demand sessions. MCT2D has divided the state into 7 regions to foster collaboration and discussion with other practices who are implementing the quality improvement initiatives. Clinical champions must attend regional meetings in the spring and fall each year. Spring regional meetings are in person during April and May from 6 p.m. to 8 p.m. Fall regional meetings take place virtually during October and November, also from 6 p.m. to 8 p.m. New practices will attend regional meetings beginning spring 2025. Eligible physicians participating in MCT2D earn a 105% VBR for their work in the program. Work with your PO to ensure that you are aware which physicians are earning VBR within your practice. VBR is rewarded at a physician level but measured at a practice level, with different requirements occurring for both physicians and practices. These are the measures that practices are going to be measured on their first year in the program. First, identifying a clinical champion and practice liaison. The practice liaison is an administrative individual who can support sharing updates and information with clinicians in the practice. Next, completing the MCT2D practice change readiness assessment. This assesses your practice's structure and readiness to do quality improvement work. You, as the clinical champion, would be the one filling out this survey, which takes approximately 15 minutes. Next, each physician who is earning VBR is asked to complete a brief 10-question survey about their experience with the MCT2D quality initiatives. We know physicians are busy, but we want to make sure that everyone's voice is heard. Thank you in advance for helping and ensuring that physicians in your practice complete these surveys. Completing the training and attending the regional meetings, as previously covered, are required for the practice to earn VBR. Additionally, we are asking that each practice collect 10 patient needs assessment, which is the survey that will be developed by MCT2D, and then submit a report on the takeaways from these assessments. As the clinical champion, you would facilitate submission of that report with your physician organization. We also have physician level, practice level, and PO level learning community requirements. We offer numerous options at each of these levels to complete the requirement, and we will share these in just a moment. To continue earning VBR for the following year, your practice must receive 80 of the 100 points associated with these activities. Each physician has to complete a physician-level learning community activity by June 30th, 2025. Your role as the clinical champion is to make sure that physicians in the practices know their options and to send occasional reminders to make sure that they complete this requirement on time. Your physician organization should help you with information specific to the physicians in your practice. Physician-level learning community requirements can be met by either submitting a brief feedback survey on an MCT2D physician-focused tool, attending a live or recorded version of our learning community webinars, and participating in and submitting a testimonial for our CGM user experience program, where prescribers can wear a CGM device to better understand the patient experience. The practice-level learning community requirement can be met by either working with a patient to share feedback on an MCT2D patient-facing tool, participating in a user experience interview for an MCT2D resource, sharing a dot phrase submission to our dot phrase library, or getting feedback on your clinic's social determinants of health screening tool. Additional options to meet the practice level VBR may be added throughout the year. Each practice must complete one of these options by June 30th, 2025. We have created an MCT2D administrative portal that allows you to track your practice's progress on meeting the VBR requirements. You can visit portal.mct2d.org and click Apply for an Account on the menu to get access. Your PO representative will review and approve your application. Alternatively, you could also ask your practice liaison to create an account instead and have them support you with tracking the practice's progress on meeting these metrics. Your PO also has access to this information and will support you in making sure the requirements are met. Thank you for serving as the clinical champion for your practice. We look forward to working with you more closely. Together, we can transform type 2 diabetes care in our state.